Okay, today we are starting with a very important topic of surgery, that is tracheoesophageal fistula. Okay, so first of all, what it is. So this is very important topic from any exam. And I said from NEET PG FMGE exam. This is important topic. So what exactly it is in the name only, that tracheoesophageal fistula. That means this is the abnormal communication between the trachea and the esophagus. One thing we have to remember, that this tracheoesophageal fistula is a congenital condition. So every time the presentation will be with the newborn. Okay, so almost always, the second line is almost always with esophageal atresia. Why it is written like this? So see here, there is esophageal atresia. Esophageal atresia is also here and here also. Okay, so mnemonic one is C. Type C stands for C for common. This we have to remember, like the type C is the commonest. And now the name of the classification is this gross classification. So we have this type A, B, C, D, E, F. F is not always included on all the classifications, so we can study this also. Here we can see this also. So first of all, type A, we'll also learn how we can remember this. This is always confusing, like which one is proximal fistula, which one is atresia. So we'll make it easy also. Okay, for type A, we have to remember it like this. Okay, type A is like all alone. So A for all alone. Only just alone, one thing, that is it is only esophageal atresia. It is pure esophageal atresia. There is no fistula. So how we can remember? A. This is type A. This is atresia and this is alone. Okay, so that type A is atresia alone. And one thing, when examiner want to give us a clue that he is talking about the type A, in buzzword will be like on X-ray there will be gasless abdomen. So this is how it will be. See, this is type A and B, always there will be gasless abdomen. And for type C, D, E, in the clinical history they can mention that there is air in the abdomen. Now why there will be gasless abdomen, you can see, like this is esophagus is atretic. Here is no fistula, air is entering from here, so no air is going inside the stomach, so it is gasless. Here also you can see there is proximal fistula, so distal is atretic na? So no air will enter from here to here, so that will also be gasless, but rest of things will be with there will be gas present. Okay, so B ka we can remember, like B ka we can see there will be proximal TEF, and distal there will be esophageal atresia. So how to remember this? B ka we can remember like bad luck, only rare. Okay, and now the both, B for both the ends are messed up. So how to remember? We can remember it like, okay, B say bebafa. We can remember this word. We have to remember this word. Okay, so bebafa mein Eva is bebafa. Okay, Eva is bebafa. So type B, this B is type B. Okay, Eva is a girl. Okay, who's bebafa, and this F is, first we have fistula and then we have atresia. Okay, so first we talk about proximal, then we talk about distal. So there will be proximal fistula and distal atresia, and B ka we have remember like both and missed and super rare. This we have to remember, bad luck, only super rare condition. Now C ka we have to remember, this C is commonest. Okay, C is this commonest, 85% cases में. And how to remember this? So this for this we have a mnemonic like C. You can write it like calf. L ka is, okay, we can ignore this L, there's nothing like L. So C ka we can say type C, and A, initially there will be atresia and then we have fistula. So first we talk about proximal, then we talk about distal. So proximally there will be atresia and distal there will be fistula. Okay, this is the most common type, this we have to remember. And for this, now there will be air in the abdomen. Why? Because here, from here, now air will come and will go from here to the abdomen. Okay, so that's why there will be on X-ray there will be air. Okay, so C ka we have remember most common. Okay, both the things. D is double trouble, like, okay, we have read this atresia, proximal distal fistula. Okay, what now, what next, what double trouble now? Here there will be like atresia will be there, but there will be fistula, but double. both proximal also, distal also. So now we have double trouble. We have fistula, but both proximally also, distal also, and there will be atresia also. So this will be like this. This is type D, double trouble. There will be proximal distal fistula, and there will be atresia also. And this is also rarest. So just we can go through this once. And type E ka we have to remember. This is important. This is also known as type H. This is little different from others. Here there will be only fistula. There will be only fistula, no atresia. This we have to remember, like only fistula but no atresia. And now this is like why it is called as type H. So it looks like this now. So there will be, here will be trachea, here it will be esophagus. So just this track will be there between both. Otherwise, like this esophagus is patent here. There's no, it's not atretic here. So now patient can swallow because esophagus is intact. But now what will happen? Whenever there will be aspiration, food will come from here and will go from, like in this path it will go. Okay, just wait. It will go like this and can enter the lungs, and that will lead to recurrent chest infection. So here for EC we'll remember, like it is easy to miss. Why? Because there is no atresia and it's usually diagnosed late. And F ka failure to what? Canalize. There will be esophageal stenosis. This we have to remember. So okay, not always okay in the gross regional. So this is what? This is type E, H type. So you can see here the trachea, you can see here the esophagus also, and this is what? This is the fistulous tract. So this we know now why this is gasless and why there is gas here. Now how do a baby present? So first of all, there will be in the history, they will mention the newborn, and this is the most like classic statement will be given in the question, that this will be drooling of saliva. This we cannot never forget. Any baby newborn is coming to us with drooling of saliva, and there will be choking and cyanosis on feet, respiratory distress, and when we try to insert the NG tube, OG tube, there will be coiling at what level? Like 10 centimeter on the X-ray. Okay, this is very important. So now we have to remember, like whenever we see this tracheoesophageal fistula in a baby, we have to remember, like we have to check all the related anomalies, vectoral anomalies. We have to see the whole spectrum of this vectoral anomalies, where we have this vertebral defects, anorectal defects, cardiac is most common, and there is tracheoesophageal, that is fistula. Okay, so this tracheoesophageal, and then renal defects, limb defects will also see. So this is the, like this type of X-ray, classic X-ray they can give to us. So that will be coiling at 10 centimeters. So first investigation they are asking, we'll try to insert the NG tube and we'll take the X-ray. If there will be coiling at 10 centimeter, okay, we can say that this is PEF. And now the most accurate, we have this contrast study, and here we have to just remember that iohexol is safer than barium. And for H type, now this in H type we know that both esophagus and trachea, trachea is patent. So when you try to insert this OG tube, okay, it will go inside, there will be no coiling. So just for specifically if they are asking for about the type H, will answer the investigation of choice is tracheobronchoscopy. This we have to remember. If they are specifically, they have mentioned type E and H, will answer this. And now the management, how can we remember? Like Waterson's criteria is important. So what is like Waterson's criteria? It decides the timing of the surgery. Okay, so how we can remember? We have to remember that classical symptom is here is drooling of saliva. Classical sign, symptom, we can say drooling of saliva. So drooling is what? Water, na? Water. So Waterson's criteria, water, like how much water is coming, so that will decide the timing of the surgery. The son, newborn, na? So we can remember like Waterson's criteria. If weight is like appropriate, immediately we can go for surgery. If weight is 1.5 to 2.5 and there is mild pneumonia, we can first stabilize the baby and then go for surgery. If weight is like very low, that is low birth weight, like less than 1.5, or it has baby has severe pneumonia, first of all we go for feeding gastrostomy, because now feeding of baby is important. So for that, firstly we'll go with feeding gastrostomy. Delayed repair will be done in this case. So this is examiner's favorite point they can ask. Okay, if they are they are specifically asking about the surgeries. So for type A, Type A is what? This is A for type A, atresia alone. So it's like whenever somebody is alone in their life, they experience it. Everybody, no, we call it in Hindi कि सब ठोकर मार जाते हैं, सब ठोकर मार जाते हैं जब जब कोई इंसान अकेला रह जाता है. So by this we can remember like फोकर, ठोकर से the operation name is फोकर. Okay, so gastrostomy and delayed. Okay, initially we'll gastrostomy, this feeding gastrostomy is done, and then we'll wait for like both the ends of esophagus is when they will come closure, and delayed will do the anastomosis. Okay, we'll see the distance between both the ends of the esophagus, and delayed anastomosis is done. For all the other types we go for Cameron Heights surgery. So we have to remember that this is the pediatric emergency. This we have to remember, this condition is pediatric emergency, TEF. Okay, so Cameron Heights surgery is the name. So how can you remember, like came run, this is emergency. Okay, this is emergency. Okay, so this is how we can remember, like right posterolateral thoracotomy is done, we cut the fistula, repair both the trachea and this esophagus. Now okay, we have to remember type, most common type if they are asking, it's type C. This we have to remember with the mnemonic cough. Earliest sign, this is told you, excessive drooling. X-ray buzzword we know. H type के लिए tracheobronchoscopy association we know. And if they're specifically asking what type C, treatment of choice is Cameron Heights surgery repair. Okay, this punch lines we have to go through once. Okay, and now what the Cameron Heights repair, this is the name. This is a standard surgery of for type C, TEF, because this is the most common actually. For all other also, only for A is Fokker operation, the name is Fokker operation. Approach we should know, like right posterior lateral thoracotomy, and these all other steps. You can go through this once, and if gap is long between both the ends, we can go for tension free techniques like mobilization, Fokkers if pure, if esophageal atresia. So this is how, like we cut the fistula, then we close the trachea and we join the esophagus. Now these are the high yield points. Type C, what it is most common. X-ray finding we know, gasless now we know, like X-ray mein type A and B are gasless, all other are having gas in the abdomen. Treatment of choice we know except type A, and treatment or investigation of choice for specifically if they are asking about the H type, then it is tracheobronchoscopy, and if they are asking about other, then we know like how do we investigate. First test is this NG tube and X-ray, and most accurate is contrast study. Okay, I think this is all about the TEF, and this will be enough to answer any question in the exam. Okay, so thank you.